Hello and welcome to another Conversations with Carrie. Today we're tackling one of the most critical issues in modern healthcare, the sustainability and survival of our frontline healthcare workers. Joining us today is Dr. Nashika Jackson Ogilvie, a distinguished healthcare leader who has dedicated her expertise to understanding what it truly takes to support and maintain a healthcare workforce, especially when the pressure is at its highest. This month, April 28th to April 30, Dr. Jackson Ogilvie will be taking the global stage at the 2026 Global Healthcare Conference in Siloah, St. Elizabeth, Jamaica. She will be presenting a complex and urgently needed topic: building resilient nursing workforces in Jamaica, a theory-driven incentive framework for sustainable healthcare delivery amidst disaster response. Today, we're going to break down what that framework looks like and how we can move beyond just asking nurses to tough it out during crises, and why this research has vital implications for healthcare systems worldwide. Dr. Jackson Ogilvie, welcome and thank you so much for joining us today.
Thank you. Thank you for having me today.
So, Dr. Jackson Ogilvie, we're going to jump right in. As a
Yes.
healthcare leader, you've had a front row seat to the evolving challenges in our healthcare systems. How have you or your personal experiences in leadership shaped your understanding of the intense pressures placed on healthcare staff today?
So, over my 20 plus years as a healthcare administrator, my understanding of this pressure on the healthcare staff has been shaped by my observation and by leading through some of the most demanding crises that we have faced in these fields, such as the COVID-19 pandemic and going through multiple hurricane emergencies. Reflecting on COVID 19, I witnessed firsthand the emotional and physical tolls on my staff. Them being afraid of being infected, having extended shift, staffing shortage, and just the weight of being the primary support to these residents who were isolated from their family members. And for me, that reinforces the need to be able to ensure that our caregivers and clinicians are more than just, our caregivers are more than just clinicians. They're counselors and they're surrogate family members. And it comes with a level of responsibility sustained over time. And it also creates an intensity in the field that they're doing. So, just by working through these complexities, I have learned that those experience highlights the deep personal sacrifices that healthcare workers have to make in these times of crises. So, as their leader, these are the experiences that shape me and how I approach these basically theories by prioritizing the staff's well-being, which is essential. It's usually not optimal, but fostering transparency and consistency with the communication during uncertain times and building a resilient system that support both the operational demand and the human need. So pretty much that's where I started looking at a theory base. So not only am I a healthcare administrator, I am also in academia because I am a adjunct professor. I'm an associate professor with the University of Arizona Global Campus. So I merged my practical experience with my academic experience.
Awesome. That was very thorough and I could follow it all along. But notice you use the word resilient a
Mhm.
number of times as well. And this is a word that we often hear in healthcare, but sometimes it's unfairly used to expect nurses to simply endure poor working conditions. How do you define true systemic resilience versus just individual endurance?
Okay, so I think that's important. It's important to make that distinction because too often in healthcare, resilience has been used as a way to place burden on the individual rather than putting that burden on the system. When we're looking at resilience, we need to be looking not on a individual person, but on a systematic resilience. So true system resilience is very different. It's about designing healthcare environment that anticipates stress rather than reacting to stress. That means having adequate staffing models, access to mental health support. Yes, mental health support. I'm going to say that again for the ones in the back. Mental health support, because
Yes,
healthcare workers' mental health status is often overlooked. Also,
yes.
having clear communication structures and leadership accountability. It means creating a culture where staff feels psychologically safe to speak up about concerns without having fear of retaliation. In other words, you can say resilience shouldn't mean how much can a nurse do, but rather how well does the system support the nurse in doing their jobs safely and effectively.
Your highly anticipated topic focuses specifically on Jamaica. What are the unique systemic, cultural, or environmental challenges that make building a resilient nursing workforce in Jamaica so urgently critical?
Okay. Well, when we look at Jamaica, the urgency around building a resilient nursing force is shaped by a convergence of systemic, cultural, and environmental pressures that are deeply interconnected. First, there's the ongoing brain drain. And this is not just Jamaica, right? But we're speaking specific of Jamaica. But as we know, brain drain affects most lower to middle income countries. So first we have the brain drain, which is the migration of highly trained nurses to countries such as the United States, the United Kingdom, and Canada. While this creates an opportunity for the individuals, it leaves a significant gap in the local systems, right? Because these persons are now removed from the healthcare systems in their countries. Secondly, environmental vulnerability plays a major role. We just experienced that with events like Hurricane Melissa. This highlights the fragile healthcare infrastructure and what they face in the event of climate related disasters. The facilities that are not able to be sustained, the fact that recovery can be prolonged, and this places continuous pressure on the already limited staff and the resources. Thirdly, and quite honestly, when I started my preparation for this conference, this was not even in my purview. But most recently, we have the shift away from the long-standing international support system, where Jamaica had a collaboration with the Cuban Medical Brigade. This created an additional layer of workforce and capacity challenges, right? This partnership helped to stabilize service delivery, particularly in the underserved areas. And I can tell you, even myself, I've had family members that was affected by the Cuban Medical Brigade and probably will be affected with them no longer being here. Culturally also, and when we look at things, we need to look at the cultural aspect. There has always been a strong sense of duty among Jamaican nurses. They've always had a deep commitment to caring for the community and also for the country. While that is a strength for the nurses, it also is a mask for the systematic strains that they're going through because of the conditions that they're working under. So all these factors together, compiles us, we look at it from, okay, what can we do to build a systematic resilience, not just an individual resilience, but systematically. Jamaica cannot rely on individual endurance to carry the system. Okay.
Correct.
It requires intentional investment in workforce retention, infrastructure strengthening, disaster preparedness, and policies that both value and protect nurses.
Man, I love that response so much. And you know, one of the reasons why I'm so passionate about this conference
Mhm.
is because we want the nurses to know that we see, we understand, we support you, and you are not going to have to fight alone with this, but we're here to support everything that it takes, as you mentioned, from a policy point of view, from
Mhm.
an investment point of view, from an environmental point of view, and a mental health point of view, to make sure that you become your best so that you can give your best. You are working in an environment that is demanding so much of you and not giving
Mhm.
back depletes the person, as you know,
Exactly.
you've communicated. And so we want to stop that cycle, begin to build up the nurses in every way. Oh,
Mhm.
I'm so excited about this conference.
Me
So
too.
your title, your presentation title involves a theory-driven incentive framework. Now, for those outside of academic circles, how do you translate theoretical concepts into practical, everyday practices?
Okay. So, like I said, because I'm in academia and I'm also a practicing administrator, when I talk about theory-driven incentive framework, I am talking about what we know from research and turn it into simple, consistent leadership practices that staff can feel, not just policies that sit on a desk or sit in paper or sit out there in the universe, right? So, for
Yes.
example, one of the theories I'm going to speak about is expectancy theory, right? This tells us that people are motivated when they believe their efforts will lead to performance, and those performance will lead to a meaningful reward. In practice, that means being very clear with the nurses about what to expect, giving them the tools and the staffing to succeed, and then actually following through with incentives. And when I say with incentives, not just pay, right? Because yes, you work, you get paid, but there are more incentives other than pay. Recognition, for example, career opportunities, for example. So that's just one of the theories that I will be speaking on, but there are other theories that I'm also going to be bringing out at the conference.
That's excellent that you mentioned that, because when we hear about incentives, a lot of times we just go to financial
Mhm.
compensation, which is wages. And of course, Jamaica is a resource constrained environment.
Mhm.
And so if an organization or a government is not able to pay according to industry standard or global standard,
Mhm.
what alternative holistic or structural incentives does your framework propose to keep nurses motivated and retained?
Okay.
I had to ask that question.
So that's an important point, right?
Yeah.
Especially with Jamaica being resource constrained.
Yes.
In a theory-driven framework, this helps to identify what actually drives nurses to stay, even when financial resources are limited. So that's why it's important for us to do this and have this conversation, right? So, for example, another theory that I'm going to address is the Erksberg two-factor theory, right?
Mhm.
This reminds us that while pay prevents dissatisfaction, it's not a true motive to long-term commitment. And research has shown that pay
Yeah.
does not let a person stay with a company longer or even stay with a company.
Yeah.
So what we've seen in practice is that recognition, professional growth, and a sense of purpose are powerful retention tools.
Mm.
Now, earlier I mentioned that Jamaican nurses are committed to country, right? In
Yeah.
Jamaica, that could look like formal recognition program, clear career advancement pathways, opportunities for continuing education, and also opportunities for specialization, right? Now,
Yeah.
like I said, there are other theories, but I could give you everything on this interview, or I can
No.
encourage persons to join us. But there are other theories that I will go into at the conference as well.
Yes, please come out and hear. Believe me, this conference is something not just to motivate, but to also to teach, to
Mhm,
encourage, to direct. Oh, wow. Okay. So just shifting gears a little bit.
mhm,
So, in your introduction, you spoke about disaster response, and you've taken organizations through very many disasters, lots of hurricane. We had the pandemic, and sometimes we even have local emergencies that
mhm.
may not necessarily meet the global news. All right. So these kind of responses require a different level of stamina and also a different type of operational coordination. How important is this framework in preparing the workforce to maintain sustainable healthcare delivery amongst really this kind of chaos?
Wow. Let me just start by saying when the COVID-19 vaccine came out, for me, that was the light of the end of the tunnel, right?
Yes.
It is absolutely critical because disaster response is where the difference between individual endurance and systematic resilience becomes more visible.
Yes.
In events like the hurricanes and the COVID pandemic, we're not just asking nurses to do their jobs. We're asking them to operate under sustained pressure, uncertainty, and often personal risk without a structured framework in place before the crisis. What you see is burnout, breakdown in coordination, and ultimately disruptions in care. A theory driven incentive framework prepares the workforce in advance by creating stability within the chaos. One of the
Mhm.
things that most healthcare organizations do is develop a comprehensive emergency plan. And that comprehensive emergency plan basically highlights what you will do in the event of a natural disaster, kind of a disaster, anything. You think of it, you develop a plan for it. And I can almost guarantee you that experience teaches me that there's going to be something that happened that was not accounted for in the plan. But what you do is you then look at what you did well, what you could improve, and then develop that into your plan for the future, right?
Right.
For example, in the expectancy theory ensures that even in a disaster, nurses know if I show up and perform under these conditions, I will be supported, I will be protected, and I will be recognized. That clarity reduces hesitation and builds trust in
Mhm.
leadership because there's nothing worse than seeing an impending hurricane and nurses are not showing up for work because
Yes.
they're afraid of, if I go in, what's going to happen? What are the resources that's going to be available to me? And also, how am I going to secure my home? So all
Yeah.
those things you have to take in consideration.
Right. Right. It's so funny because 2025 Global
Mhm,
Healthcare Conference, I presented on disaster preparedness because a part
mhm,
of my role as director of education is preparing the organization on an annual basis for
mhm,
disaster responses, chain of command,
Mhm.
activation of resources, activation of support, things like that. And
Exactly.
a term came up, um, or the description of what the nurses experience or fear is
Mhm.
moral distress,
Mm.
because there have been occasions in the past, and obviously this happened during this hurricane, where they knew what to do, but the
Mhm.
resources, the support, the communication were absent.
Mm.
All right. And so, um, no, they didn't have everything, right? So they learned quite a number of things, but they did share that there are occasions, and
Mhm.
it's so funny because nobody had ever experienced something like this.
Mhm.
But the year before, we had Hurricane Beryl, and some persons felt that, okay, we went through Beryl, this is going to be something different, but it was absolutely different. Okay.
Mhm.
And so I bring this up because you mentioned about learning from the past and
Mhm.
bringing it forward in preparation for a similar event.
Mhm.
All right. And now we know that implementing new frameworks requires significant buy-in
Mhm.
from both the workforce on the ground and the policymakers on the top. Now, my question is,
Mhm.
what do you see as the first most crucial step
Mhm.
in moving the model from theory into sustainable practice?
Okay. I with that, I would say first and foremost, a crucial step is in building trust through a visible early win at the facility level. If it's a hospital, the hospital level, not just starting with the policy, but with practice, right? In a
Okay.
system like Jamaica, where there's a real resource constraint, there has to be political consideration. You know,
Yeah.
there's workforce skepticism shaped by their past experiences. Large scale reform can feel abstract, right, and distant. So instead
Mhm.
of leading with mandates, I believe that starting with pilot approaches, right,
Yeah.
implementing the framework in small numbers, maybe pick one or two facilities and implement the framework and have that demonstration, show that proven demonstration of how that process is working and is successful, and then take it out, right? That's where the theory comes to life in a more tangible way. For
Yes.
example, if you're to look at, let's say, the equity theory, if you're making scheduling and workload distribution more transparent, or by using a goal setting theory to align staff around a clear, achievable priority during high demand periods, such as a hurricane. It doesn't even have to be a hurricane like a Melissa of a hurricane, but a hurricane coming, right? When a nurse feels a difference, when communication has improved, when recognition is consistent, when the system is perceived to be fair, that builds grassroots buy-in, right? At
Yes.
the same time, those early successes create something policymakers need as evidence, not just theory, but a measurable outcomes. Though this, say for example, if you're tracking reduced absenteeism, improve retention, better patient satisfaction, better patient outcome, that
Yeah.
allows the leaders of those institutions, those hospitals, right, the Ministry of Health, to justify asking for resources to scale this model into a national priority or into a budget priority. So, you know, it's also important to engage the nurses and the frontline staff in the creation of this process, because you're gonna need their buy-in, right?
Yeah.
And then basically you take the successes from this and take it to the policymakers so they can then broaden the system with the outcomes that were recognized.
Let me tell you something. So many questions popped into my head. So many questions popped into my head, but I'm going to try to reserve some for the conference because
Okay.
I'm very excited about the process
Mhm.
because that part is missed a lot of times, and some persons become impatient, and some persons who do not understand the importance or the relevance
Mhm.
may not necessarily um, buy in until after first pilot, second pilot, and
Mhm.
so a lot of questions. I'm very excited. So you're bringing this vital research
Mhm.
to the 2026 Global Healthcare Conference. What is the core paradigm shift you're hoping the audience takes away from Jamaica's experience?
We lick a butt with Talawa. I'm
Come up
joking.
with Siloah. We're
Listen,
leading in this, even with a
listen,
185 mile per hour hurricane.
listen, this little island nation, yeah. So the core paradigm shift that I hope the global audience takes away from this is that resilience is not built by asking more of people. It is built by designing better systems around them. Too often, globally, we respond to healthcare crisis by expecting the frontline workers, especially our nurses, to stretch further, endure longer, and sacrifice more. Jamaica's experience shows us that there are limits to this approach. In a context shaped by workforce migration, resource restraints, and environmental vulnerability, we simply cannot rely, just like I said before, it's not an individual thing. It has to be a systemic thing, right? We have
Right.
to be intentional about building systems that support, protects, and retains workforce. Now, interestingly enough, like I said, this is why I said we lick about with Talawa.
Uh-huh.
America has already shown the world what is possible when we think differently about human development. Don't know if you're aware, but in the 30s, Jamaica had a early childhood development study. It was described as the 70 to 700 to 70,000 experiment. That experiment was actually utilized on a global scale. Talk about a pilot program, right?
Oh,
So it
yes.
demonstrates that a small evidence based intervention applied consistently can produce life changing outcomes that scales across population. And like I said, this is the 30s, so even generations, right?
Right.
Again, it's investing in people, right? The core of it is investing in people, investing in our nurses to, build motivation, equity, and goal setting.
Oh, wow. That's awesome. That's awesome. So, Miss Nashika,
Mhm.
how do you see the ideas uh, from this conference directly benefiting local healthcare systems and disaster preparedness strategies worldwide?
Okay. Um, so, and I've been to a few conferences, and I think what makes conferences like this so powerful is that they move us beyond conversations into
Mhm.
connections, collaborations, and implementation. The
Yes.
future of healthcare is increasingly integrated, data driven, and collaborative. These systems are designed to streamline everything from patient care to workforce management,
Yeah.
communication, and operational efficiency, right? So when we bring global leaders together in a space like your conference that's coming up to benefit a local system is very direct. First, knowledge becomes actionable.
Yeah.
Conferences are not just ideas. They are about translating real world challenges into adaptable solutions. As seen in a global healthcare gathering, decision makers, administrators, clinicians engage directly to understand workflow challenges, scalability. And there may be even persons there that can help with innovations, right?
Yes.
The second point is partnerships are formed that outlast the conference itself. So, yes, you're coming to a conference, but the partnerships that are formed there will outlast the conference, and those ideas can be implemented not only in Jamaica, but also globally, right? And I would say, third and most, well, I wouldn't say most importantly, but third is disaster preparedness, technology, and system thinking are shared across borders. Tools like healthcare systems, coordinated scheduling platforms can, be implemented. Whether it's with a hurricane, a pandemic, these systems can respond in a coordinated real time
Mhm.
way rather than reacting in a silo. So I think your conference will bring these together, right? And that's what I think the benefit is.
Awesome. Thank you so very much for that response. And so I have one last question, and I think this question is just to wrap it up. For those healthcare professionals, administrators, policymakers, students who are deciding whether or not to attend, why would you encourage them to attend the 2026 Global Healthcare Conference?
Okay. So for the healthcare professionals and nurses, this conference will offer something you don't often get in your day-to-day environment. You're getting access to global perspective, practical tools, evidence-based strategies that can immediately improve how you work and how you get supported. For the administrators and leaders in healthcare, I would say that this is a space to rethink how you design your healthcare system, not just to function under normal conditions, but to remain stable under pressure, right? And then for our policymakers, this value is even broader because this conference provides evidence, partnership, and scalable solutions that can help inform national strategies. And last but definitely not least, because they are the future, for our healthcare students and emerging professional, this is where you begin to see your role in the global healthcare landscape. You're not just entering a profession, you're entering a system that is forever evolving, and this conference will equip you to be a part of that transformation. And in closing, what I would like to say, since my whole topic is resilience and building a resilient system, if we want a resilient healthcare system, we must stop asking people to carry the weight, and we must start building a system that carries people.
Ah, Dr. Nashika Jackson Ogilvie. You know, I enjoy my interviews, but this one hit me differently in the soul. Let me tell you, I thank you so very much for your time and for answering our questions. We look forward to what you have to offer to the healthcare industry globally. We thank God that you got the experiences that you did to help little Jamaica and the
Yes.
world understand the importance of building resilient systems that support workforce that cares for the people. And so I thank you once again so very much. To our audience, join us at the conference where this conversation not just continues, but this conversation gives you the skills, the knowledge, and the motivation, and most importantly, the support that you need to make a difference in your environment. God bless you, and I see you in the next conversation with Carrie.
Thank you. Have a good day.
Thank you so much.